Hi everybody, welcome to my YouTube channel, and today's talk is 5 tips to help you prepare a presentation for a nursing interview. So I suspect if you're watching this you might have an interview coming up, so I hope the tips help. They're really generic, you can use them for any role that you're going for and in any field. And good luck when you do go to your interview. So my first key tip is to keep to the brief and to do what you're asked. And it's surprising how many people go off the brief, and that's difficult because if it's a 10-minute or 15-minute presentation, it isn't very long and you're going to be wasting time on presenting something that wasn't asked for. Usually short presentations are requested as part of a senior nurse interview to differentiate between candidates, so take them seriously. If candidates are scored very similarly in interviews, they will go down to look at the presentations and the scoring. Usually topics relate to the role or current nursing issues. First thing to do is to reflect on the key words that are posed or the statement given. So sometimes they will give you a statement and say discuss, and sometimes it's a question that's posed, and they might use words like evaluate, outcomes, aims, objectives, vision, quality standards, evidence base, and you need to understand what those words actually mean before you even start your presentation, to do a bit of background reading. The same with key healthcare terms. When you're bringing in, people will be doing some background reading, and when they bring in healthcare terms, they sometimes use buzzwords to try and impress the interviewers. You really need to understand what these words mean, because at the end of the interview, you might be asked questions, or end of the presentation, or within your interview. So knowing what a quality standard is relating to the topic, clinical governance, it might be to do with leadership or management, health promotion, whatever the terms are that you're bringing in, that you totally understand what they mean. So I've suggested that you look at key terms, buzzwords that you're not quite sure about, but also reflect on the actual statement or question that's been set to make sure you keep within the brief. For example, this is an example presentation. Over the first 6 months in post, how would you plan to meet the training and professional development needs of ward staff? So key things coming out here: over first 6 months, so they're not asking over the next 5 years. I mean, you might at the end of a presentation mention that this would cover, there'd be some key areas, but if it's a short presentation, you won't have enough time. You need to keep to the parameter that's been set. Training and professional development, and so you'd be focusing on essential training. You'll be new to a role, you'll be looking at what the employer has set as essential training and professional development to ensure safety, for example. And it will really narrow down your talk if you just reflect on the key aspects of what they're actually asking for. Ward staff is another thing that's coming out here. So if it was for a team leader role, you'll have a set team that might be unregistered nurse, support workers, it might be a nursing associate, assistant practitioners, registered nurses. If you were a unit manager, the staffing, ward staff may be a larger group. You might cover ward clerks, for example, and you might cover a group of team leaders, and you'd be looking in your job description for that information. What are my line manager responsibilities? What ward staff am I covering in this role? So hopefully that's given you an example, because sometimes people will read the statement or the question and won't cover what they're actually supposed to be doing in that role. So looking at your job description and making sure you do what you're actually asked to do is important. Some of you may not have a teaching background, you may haven't done many presentations in your career. So it's important though that you have some form of structure to your presentation. Some of you might have done courses and you'll know this anyway, but with a short presentation, you still need to have a structure, an introduction. You might give an aim or an overview of what you're going to cover. You can just verbally state it or have it on a PowerPoint slide. A main body, which is the main bit of your presentation, should be clearly, systematically presented. You might have some practical examples to make your points, and have theory underpinning those points and references, and have a conclusion or a summary statement at the end of what you've covered, and you might throw it open to questions. It depends on how long you've got. And you need to think about your presentation method. Are you going to use PowerPoint slides, a poster? I do know people that have used posters, but they still have an introduction, a main body and conclusion when they're presenting their poster verbally. And most people I know would do PowerPoint slides, or there are different ways of doing presentations, but they have slide presentations because they feel more confident and comfortable. And also think about your visual aids and your images that you might use as part of your presentation too. So tip 3 is to have theory underpinning your content. I have never known a talk for a senior level post where they would expect you just to talk about your experiences. Now, it may happen, and I never say never, because you need to check the brief that you've been given, and if they say not to include theory, they just want your experiences, then you would do that. However, most interviewers would expect you to do some background reading and to know about the theory underpinning your talk, and to have references on your slides. And you might also want you could give a reference list out at the end potentially as well. And it's about integrating relevant theory, so it will totally depend on your topic or the statement that's given. It might link to local, national policies and guidance, and it helps demonstrate that you're reflective, you're an analytical, critical thinker when you integrate theory. But your talk needs to be focused. It's not about it's about having the most up-to-date relevant literature and not reeling off lots of descriptive references and government documents. So you're not reading out large chunks of documents. It's about maybe having a bullet point with some of these documents on and summarising what you gained from that document, what essentially it's saying and how it links to your topic area. Systems and standards of care are important as well. You might have national, if your talk links to standards or evaluation of care, so national safety standards, it might link to professional standards, key performance indicators. It very much depends on what your topic is that you've been given. And you might want to think about local audits, CQC reports or risk assessments, incident reporting. And if you work in an area and that's your topic that's been given, go and talk to safeguarding leads as part of your research for the role. And it helps you interview as well for questions. And I have got a PowerPoint a talk coming out on preparing for interview for more senior level roles. I've got one for newly registered nurses and one for senior level roles. And part of the preparation is to attend an informal visit and to do some networking before your interview, to do some background research if you don't work in the area. Even if you do work in the area, you may not have thought about contacting leads as well, so that is quite a good talk to prepare. And NMC standards as well. So for example, the talk I gave on the previous slides, the title looked at over the first 6 months, how do you meet the professional development needs, education needs of ward staff? The NMC has educational standards, and we also have national standards for Statman training, for example. Statutory training is law. We have to ensure that staff would meet the requirement for statutory mandatory before they work in an area, for example. My fourth tip, one of the most important, prepare and practice well in advance. There may be people out there who have secured posts that have prepared the night before and done brilliantly. absolutely fine, but I wouldn't recommend it. So spend as much time as you can preparing for a presentation within the constraints of life that I know are there, because it could differentiate and be the difference between candidates. It might just be a few points on a presentation that was the difference between the candidates. Practicing beforehand helps to decrease your nerves too, and rehearsing will help you gauge your timing. So you do it in front of your family or friends or partner. I've done prepared presentations before, just talking to a pillar on the sofa, but it'll help you gauge those timings. And it's fine to prepare prompt cards if you need them. You're not expected to know it all off by heart or to just read lots and lots of narrative off your slides, and try and make contact with your audience. So if you've got these aren't prep notes, it's just blank piece of paper, but what you can do is, if you've got little cards about this size, you might have some sentences written down, and every second sentence you might put a red dot and look up. So you consciously look up at your audience. It just reminds you to. And also that tends to slow you down and your breathing down a bit, so you're not talking too fast. And as I said, if you're gauging your timings, what people tend to do that aren't used to teaching is to write everything so they don't forget it, but they cram their PowerPoint slides, and you really shouldn't. You only need sort of 7, 8, 6, 7 lines really on a PowerPoint. Your size should be about 28 points on whichever font size you're going to use. Type of font, sorry, it should be about 28 or more, not being too small. But as I said, you can use those prompt cards if needed. And finally, number 5, leave the audience with a final punchline. So you can summarize your key points in one statement. You might want to be creative and have a visual, or use a powerful, relevant quote to get your final message across. So my final message on the next slide: preparation is key to success. So I hope that the session has helped you today. If you would like to put comments or ask me any questions, do in the YouTube comments. You can contact me on my website or DM me on Twitter or Instagram. And good luck with your interviews.